what we'll do now is we'll discuss some points regarding the treatment of CML. And as we've mentioned in previous videos, the mainstay of treatment are these medications called tyrosine kinase inhibitors, or TKIs. As we've discussed previously, they're very, very effective treatments, and they've really revolutionized the treatment of patients with CML. What these drugs do is that they're targeted treatments blocking the abnormal protein that is produced called the BCR-ABL protein, which causes the proliferation of white cells and the actual disease itself. We're very fortunate now in the modern era to have a whole range of different tyrosine kinase inhibitors. And you can think about them in terms of the generation that they were actually produced. Earlier generations were produced a lot earlier, and then later generations were produced more closer to our time. The first generation of these drugs, which really showed massive changes in terms of life expectancy, was the famous drug imatinib. And then we moved on to more second generation drugs. So these are drugs such as nilotinib, dasatinib, and bosutinib. And these drugs are more potent in that they can control the disease a lot quicker, but through various different studies, they haven't really shown a difference in terms of survival. The third generation of these drugs was an even more potent drug called ponatinib, and this drug is very, very useful at certain genetic abnormalities that may develop in the condition, in terms of the course of a patient's condition. And one specific genetic abnormality is this mutation or change in the genetics of the condition called a T315I mutation. And this is the only drug that, in the UK at least, that we can use for this condition. There are other newer drugs, and one particular drug which has a novel mechanism of action in that it affects the BCR-ABL protein in a slightly different position to what all the other drugs I've mentioned, is a drug called asciminib. And all of these drugs are very effective in controlling the condition, but they all have very different side effects. And it's important to tailor the actual drug based on the patient and the side effect profile, and to maintain the best control of the condition, as well as lowering the potential side effects and issues that they may experience, giving patients with CML the best quality of life as well. So in terms of which TKI or tyrosine kinase inhibitors should be used for individual patients, you really have to consider a whole range of different factors. One is, as I mentioned previously, the classical side effect profile which is associated with that particular drug. We know that some of these drugs are associated with a higher risk of cardiovascular disease or lung issues, and if patients do have these in their medical history, then we're a little bit cautious about using these kind of medications with this in the background. Pregnancy plans or fertility in women of childbearing age is important. And it's always important to discuss this in detail and plan these things as much as possible, because we know that some of these medications can affect the fertility more with regards to females as opposed to males. And it's important to know that if there is a history of the condition changing, where there may be some mutations develop as a result of the condition as patients go along, which may confer resistance to treatment, then there are certain drugs which are effective for certain mutations and certain drugs which are not effective. So these need to be taken into account. Ultimately, as a haematologist and as a healthcare professional, these decisions are quite nuanced, and they should be in collaboration with yourself as a CML patient, with the CML team that's looking after you as well, taking into account all of these factors.